Hi, my name is Charity Dilgard. I am 23 years old and a student at the University of Tennessee Health Science Center. I am currently in the dental hygiene program and in the 10th week of my pregnancy. That means I'm still in the first trimester of pregnancy. Common oral health conditions associated with pregnancy include pyogenic granuloma, also known as pregnancy tumor, and pregnancy-induced gingivitis. Pyogenic granuloma usually doesn't occur until the second or third trimester, but the gingivitis may begin as early as the first few weeks of pregnancy due to the influx of hormones causing vasodilation to the oral cavity. Although these conditions are common, I currently have not experienced either. I have noticed these changes. Due to my diet and current cravings, my food intake has been more acidic and cariogenic than my regular diet. Not only is my food contributing to an acidic atmosphere, but I am also adding a lot of lemons to my water when I'm not drinking Kool-Aid or other beverages with sugar. Because of nausea and morning sickness, vomiting has also added to the acid exposure of my teeth. Before I got pregnant, I maintained a rigorous oral hygiene regimen. Now, due to my current condition, I am barely able to brush my teeth in the mornings without activating my gag reflex and getting sick. I have to use less toothpaste, and my flossing is no longer as frequent because putting my hands in my mouth to floss my posterior teeth activates a gag reflex. As of right now, I am considered a perio type 1 difficulty A. I have little to no calculus buildup and no pockets greater than 3. I am currently taking Zofran, a medication used to treat nausea. I have not experienced any oral side effects due from this medication. I have come up with a plan to improve my oral health status. First things first, I plan on using Sensodyne. It is a toothpaste for people who have high acid intake. I plan on brushing with this in efforts to prevent acid erosion. In addition, I also want to rinse with water after I eat acidic foods. To increase salivation, in order to buffer the atmosphere of my mouth, I plan on chewing sugar-free gum, such as Orbits. To reduce gagging, I'm going to use smaller amounts of toothpaste and expectorate more often while brushing. I'm going to incorporate a fluoridated mouth rinse, such as ACT, to my morning and evening routine as well. Although flossing is difficult, I'm going to push myself to floss at least once a week. A big change I plan on making is bettering my diet. I'm going to focus on eating foods that aren't as cariogenic, and I'm going to try to cut sugary beverages from my intake. Some devices I thought that may be able to help would be a flosser with a long handle. This would possibly reduce my gag reflex because less would be in my mouth. Also, to clean my tongue, I'm going to use a wet rag, put a little bit of mouth rinse on it, and lightly rub my tongue in order to reduce the pressure and eliminate gagging. It is very important to keep your teeth healthy during pregnancy. Lack of oral hygiene has shown relation to low birth weight babies and also delivering early. Dental procedures and cleaning should be postponed until the second trimester of pregnancy. The first trimester of pregnancy is no walk in the park. Thank heavens it is only 12 weeks. Thank you for listening.